Welcome everyone. 2020 has been a challenging year for many of us. We're in the middle of pandemics. There's a lot of confusion, myths, misconception around this particular pandemic. We're waiting for a vaccine to be developed soon, yet we are unable to bear the stigma associated with it. So in this discussion, I talked to expert Dr. Chetan, pulmonologist based in Bangalore, India, wherein we try to go deeper into the scientific aspects related to COVID 19. So, the first question is, what are the key facts about COVID?
Key facts, there are a lot of facts about COVID, not just one or two. It depends on what misbelief people is having. It may be regarding the way it is spreading, the way people are getting tested unlimitedly, indefinitely. I've shared a lot of posts in my Facebook regarding the same. So there is n number of tests being done from the government side, and because of fear and anxiety, people are getting tested. So somewhere down the line, I thought we should discuss in detail some facts about it. So precisely, if you want to ask me, first of all, should I get tested? Firstly, so the main point is, first of all, I should have symptoms of COVID. Symptoms of COVID means first I should, not all patients present in the similar fashion. Some patients might have predominantly fever, some might be having predominantly cough, some might be having just myalgia, body ache, some might be having just loss of taste and sensation. So there are a lot of presentation of symptoms. So if I am having symptoms, then I need to get tested. It's not that just because my neighbor got positive or my friend got positive or my office colleague got positive, I shouldn't get tested, because once somebody is exposed, all won't catch the infection in a similar fashion. There are a lot of genetic factors come into account. There are a lot of ACE2 receptors, what we call in our oral cavity and all. So there are a lot of genetic factors as well as the viral load itself. So if there is a low viral load exposure, definitely won't catch an infection. So, but there is this fear and what has happened, fear and anxiety right from the pandemic time, from the year starting. So this concept of spreading asymptomatic carriers, what we say, that has widely been circulated, and that has caused that panic. So once someone is positive, we start thinking that even I'll become positive, and I want to get tested. So the question is, once you get tested, what are you going to do? That is important. So one has to think for it. If today my report comes positive and I'm asymptomatic, I need not do anything. Once my symptoms starts, then only I need to start on medication. Then only I need to take appropriate steps. And in medical, we classify cases as asymptomatic, mild COVID, moderate, severe COVID, based on the clinical presentation.
So, according to you, what are the simple and effective methods one should deploy to protect oneself and also others?
See, any pandemic has phases: phase 1, phase 2, phase 3. So initially phase 1, it's a very limited spread. It comes in some areas. So that was logical. That time it is logical to isolate people or cordon off that area and all. But once it has reached to a phase 3, all over the world is now in the phase 3, community spread. You can't stop its spread. It's a natural course. It spreads slowly among the community, and it reaches herd immunity. So herd immunity is where at least 40 to 50% of the population gets infected. Then we attain this herd immunity, so that there won't be any carrier or spreader of infection. So that is more effective than actually vaccine. So there is the concept of strains keep changing every season, antigenic shift and antigenic drift. So even if the vaccine comes now, it is not an happy ending for all the people around the world. After 3 months or 6 months down the line, you might get a different strain because of the change in weather season. So then you need to update your vaccine also. So the basic thing is, the strains keep changing. Like just previously we had H1N1 from 2009. It keeps changing. It will be in our community. Same way with COVID. We have to live with COVID. We can't run away with it. We have to accept this fact first of all. So first we have to develop some scientific understanding that this is spreading through respiratory droplets. So wearing a mask, maintaining a social distancing, hand sanitizing, maintaining basic hygiene is enough. In spite of that, we might catch an infection because it's too difficult to follow all this at all time, at all levels. In spite of catching an infection, one need not get worried. It will resolve like any other viral fever. So for 85% of the cases, it will resolve like any mild viral fever, which causes body ache, fever, some cold, cough for some few days. But for those patients who are, aged above 50 years, who's having underlying, lung disease, liver diseases, heart diseases, kidney diseases, or who's having asthma, who's transplant patient or a chemotherapy patient. These are the risky population, and even obesity also, which we tend to forget or neglect it as a disease itself. So a lot of young patients, even doctors who have died, are basically obese people. So we need to keep that factors in mind and start treating our underlying diseases properly first. So basically, it's not the COVID; it's your underlying disease which is aggravating to death. So one should understand that, and even obesity also. So right from now, we should start maintaining a healthy diet. It's important. That's the key message. COVID, like this, viruses will come and go in some years. 2-3 viruses will go. Every time we need not get panicked and keep taking vaccines after vaccine, or getting panicked and locking down all other factors coming into place. So we need to see the underlying factor, keep our underlying disease under control, maintain a healthy lifestyle, diet, and obesity also under control.
You already mentioned a bit about it, is when to seek a medical care. So according to you, only when somebody has a symptom, that's the only time they have to go and check? Or
Yes. Symptoms. I initially in my talk I started with that. So basically, symptoms we categorize as mild, moderate, severe. So based on the respiratory rate and pulse oximetry, you might be now widely heard about it. The pulse oxygen saturation. If it is after walking, after having a brisk walk for 5 to 6 minutes, if the pulse oximetry saturation is above 95%, that means he is still in the mild category. He can be treated adequately with a home quarantine OPD basis of treatment with just simple 3-4 tablets. So he need not get admitted. But we need to keep a close follow-up, because as I said earlier, this elderly patients or the patients who are having underlying diseases, chronic diseases, they might come into a moderate category later. Their saturation might come down, they might require oxygenation and immediate hospitalization. So, but that happens only with 15 to 20% patients. So that is being missed. That message is being missed, and all are getting admitted with panic. And hospital healthcare staffs are getting fatigued, and we are not able to concentrate on the really sick cases who require medical care. So that is the key message. So you need to see where you're standing. You're asymptomatic, you're mild, moderate, or severe. So if you are mild, no need to worry much. You can take OPD basis physician or a pulmonologist consultation and take treatment at home, and update your physician or specialist how your pulse oximetry and how your symptoms are going on. And basic investigations, chest X-ray, CBC, CRP, and urine. Some basic simple tests is enough. You need not get hi-fi investigations done for all patients. So that is the key message.
And right now, there is also this myth going around the various treatments available, especially like herbal treatment and this and that. So what's your take on these myths?
In this also was being discussed here in my talks in India. So 98% especially in India, the mortality rate is just 2%, less than 1.9% precisely. So hardly 2% are going to die of 100 infected patients. So 98% are going to survive. So I can claim any medicine as treatment for COVID. That's what is happening. So people should understand that. So if anyone claims their medicine as treatment for COVID, it should give mortality benefit. That means without giving any additional drug, any allopathic or English medicine drug, that pure herbal medicine should cure his COVID, and he should not go to the ICU or he should not die. Then only it is scientifically justified in giving. Simply, round the clock, or anyone can come and tell, my medicine works, because everyone knows 98% are going to come out. So that is not the right way. It has to be, scientifically judged with a placebo or a standard drug with the COVID. But right now, there is still not a standard drug in the COVID. So it has to work against the placebo. So you're not going to give any other drug. You're going to give only this herbal medicine. And we should, those sick patients, I'm telling you, those who are having moderate to severe cases, those patients should get cured of this herbal medicine. Then only it is justified as a treatment. Until and unless it's just an immunity booster and it's just an supplement.
And what about your thought related to the stigma which is attached due to the COVID. It seems to be quite a lot, and it's really affecting people in various ways. But what's your thoughts on that?
Definitely, lot of jobs have been lost, lot of insecurity. People don't know what to do next when they lose their job. And on top of that, if they get a COVID, it's a cost burden to their family, especially in a country like India, developing country, middle class people, they suffer a lot with all the issues going around between the government, private hospitals. So the thing is, stigma basically comes with half knowledge. So if we don't understand a disease properly, then that fear that a person, my neighbor has, and I will get infected and I'll die. That creates stigma to that person, my neighbor. So one should understand, as I said, the scientific approach, how the disease is spread, and one should understand once it is phase 3 community spread, naturally many are going to get infected. So we need not blame someone for me getting an infection. The natural course of a pandemic, herd immunity will come. So of late we have seen 8,000 plus depression cases in India itself because of COVID thing. Many have died in the ward while taking treatment, even though they are getting better because of this stigma of COVID. That how their relatives are looking, how their family members are looking, how their friends or office colleagues are looking when they got infected. That is creating a lot of stigma and depression in patients, and some have given up their life, and some, before they get itself, they are so much depressed that they might get the infection at any time, and they're worrying about it 24/7 since 3-4 months. Their family life is affected, their personal life, everything is being affected. This is because of the hype in media. Daily, the media showing the news of deaths, number of cases infected, or some person near your area getting affected. That's creating a panic, and that has caused this depression, stigma, all sorts of things which is going on. So let us take a scientific approach. Let us calm down. Let us understand it's a pandemic. Some people are going to die. Let us accept that fact, because that is the way the disease is behaving, especially what I said in the special category, age group patients or underlying disease. So the purpose is we have to safeguard those special category patients. That's the most important thing. For a young, healthy 20 to 50-year-old guy, it will come like any other viral fever and it will go on. So no need to worry much. So the only issue is we need to protect those senior citizens and the special category patients from getting infected. Even in spite if they get infection, for sake of understanding, early treatment, early identification of the disease, early initiation of medications can give still more better results. So let's not panic. Let's spread science. Let's spread facts. Let's spread reality and fight the disease problem.
What do you recommend those who not necessarily understand the deep science aspect? How do you kind of give advice, or what is your advice on that?
It is a collective responsibility. Everyone should pitch in, including media, including doctors, including government, including all NGOs, public. They should listen to the responsible person. If some person sets some guidelines, they should follow it, and they should not break the rules. That starts creating further more problems. It's a collective responsibility. This is a pandemic. It's not some particular problem or some problem for certain groups or certain community as such. So it's a pandemic. It's a collective responsibility of the whole nation and the whole world. How are we going to face it? Are we going to spend a lot irrationally? Are we going to spend logically, improving our ICU care? How better we are going to get our ventilators, HFNC machines, ICU staff, nurses trained for this pandemic, or just we keep on testing irrationally and creating more stigma, more uneasiness in the society. So we need to have a scientific approach. So we need to first of all have a reality check how the disease is going, who are getting infected, what actually has to be done to the public. It is in a country like India already there is shortage of ICU beds, critical care support. So that has to be improved in the first place. We are more bothered in this mild and asymptomatic case, which is not required. They can get treatment at home and OPD. But we are too bothering, and we have spent a lot already in India for that matter, for the containment zone or testing matter. The target being set for primary healthcare doctors that so many tests has to be done. It's not all illogical. When the phase 3 spread has started, many are going to get infected. If you keep checking, many will come positive. The only question is whether he has symptoms, whether he requires hospitalization. That is the question. So that happens once he gets symptoms, he can come and get tested and get appropriate treatment based on mild, moderate, and severe. So you not check full community or full nation and show to the world that okay, this cases I'm checking and this is the way we are. That's not required actually. I don't know why this thing is being done in the entire nation and the entire other countries also. That so many cases we have tested, so many are complex. I don't know. Nothing is being achieved out of it.
And then one final question is, there's also a lot of confusion regarding this whole traveling, right? With the air travel,
Yes.
bus or train, whatever. So according to you, how should one take care of themselves? Because sometimes you cannot avoid traveling because of the work and
Off late that I also observed in all the flights. Some flights are asking to wear PPE, all those things. It's not required. It's surface transmission, foment transmission is very minimal in COVID. So even if there is some viral, until unless you touch your eyes, nose and mouth frequently after touching some foment transmission, then only it spreads. That too, the transmission is very low. The main transmission is through respiratory droplets in 1 to 2 meters. So this, wearing PPE all over, and this especially the thermal scanning. That is a very false screening done right from the pandemic started, even in Indian airports. So 80% of the cases don't have symptoms. So how will you screen a person whether he's COVID or not? So a lot of cases were missed initially in March because of this false screening in the airports, where the patient was afebrile and he can just swallow a paracetamol tablet before the landing of flight. Just 1 hour prior to the flight landing, if he swallows a paracetamol, he'll definitely be afebrile and he'll cross the airport check. That's not the approach. So once if there is some outbreak of certain disease, that person must be quarantined in some place for 14 days. That's the important message that was missed even in India. So just this thermal screening was done, and whoever afebrile was left into the community, and from there only the spread started. So in case in future some other virus breaks out in some other country, then this concept should be deeply taught by all the government authorities and airport authorities, that person is going to be monitored quarantine. Is not just sent for home quarantine. People may go around, they might break the rules, and that's how it spreads. So once some pandemic, some epidemic in a small country breaks, then the international flights travel happening. Then that person, when he reaches the other country, he needs to quarantine for 14 to 21 days based on that disease incubation period or the viral phase, whatever. So based on that, he needs to quarantine and limit his disease to himself and not spread to others. And this false screening of this thermometers and all should be stopped. Instead, you can use a pulse oximetry. As I said, you can categorize them as mild, moderate, severe. So that must be used more in offices and factories and workplaces. So that will be a better prognostic factor who requires hospitalization, who doesn't require an hospital.
And there's also a big fear among doctors right now regarding this COVID itself. There are very few doctors who are coming forward to work and stuff. So, and you are being kind of fighting, being in the front. So what's your take on this, and what's your message for the rest of the doctors?
I'm not that great doctor or a great senior person to advise other doctors what to do, what not to do. But one thing I thought from March is I have never shut down my clinic, nor stopped going to hospital, not even a single day. Right from March, my clinic is open and I'm going to the hospital where I used to go. And I thought it's a responsibility of being a doctor, to rise up to the occasion and do our things better. So that's what I did. And to be honest with you all, I have not got even an antigen or RT-PCR test till now. Not even an antibody, IgM and IgG and IgM, because it is not required. I have never got symptom any day. I wear my PPE, I wear my mask, I wear my face shield. I see cases, I come back. That's it. It might have come to me and it might have passed with a mild, symptoms. I never recognized that. So where is the point in me getting it tested unwantedly? And if that fear is there, I need to get tested every week. If I have that fear that I'm seeing daily 110 cases, COVID cases, so I need to get almost in a week, I need to get once or twice tested. So first, let us have a practical approach. That if I have symptoms only, I'm going to get tested. Otherwise, not. So even this message I'm giving it to doctors, not to fear much. Go, do your work, do your karma, do your best for the patient. Because this is a pandemic and definitely public, the whole world is dependent on us, doctors and nurses. So we need to rise up to the occasion. And I agree that government is not being that supportive to doctors or nurses. And I request the authorities to have a serious look about doctors and nurses in India to give appropriate care, appropriate needed facilities, much more understanding between the private and private hospitals and government. Whatever it might be, a fee capping or what.
Yeah. And also, I just remember one important thing, because there's also a lot of news we get to hear regarding students having a lot of panic regarding COVID, and also they're not able to have their exams. And there's a lot of questions which was going around NEET and JEE recently. And also every state seems to have their own idea regarding this. And many of the students have also lost their life. As you said, it's because of the stigma, it's because of the fear that the career is done. What's your message for the students who are listening into this talk?
So definitely exams were always conducted with social distancing. So that was a fact. We used to have 1 or 2 meters apart whenever we used to write exams. So there's no issue in getting conducted exams. Things has to move on. We can't sit back at a home 24/7, do online classes. That's not, it's not going to happen for a long time. Okay, when I said when we were in the phase 1 or phase 2, it is okay. It's understandable that this lockdown has to be done and we had to adjust for all these online classes. But not now. In this community spirit, it is going to spread, and we can't sit back at home, shut down all our offices, school, colleges, and break our economy also. So let's understand. Let's leave with COVID. Let's move on, and let's take precautions. So there should be a thin balance between fear and not being fearless. So that we have to maintain. So we need not be anxious also. At the same time, we will not be fear.
I hope the discussion with Dr. Chetan has been very useful and has given you science-based factual information related to COVID. He himself has treated over thousands of patients in the last 6 to 7 months in Bangalore, India. It is very important in these times we have a deeper and clear understanding of COVID. We support each other, we break all the stigma associated with it, and most importantly, remain calm. I wish you all the very best. Stay safe. We are in this together, and look forward to see you all soon in my next video. And yeah, don't forget to subscribe.